Good afternoon, everybody. My name is Rance Baker. I'm with the National Environmental Health Association. Well, at least good afternoon to everybody on the mainland here. It's finally afternoon for those who aren't. Good morning, good evening, aloha. And anyway, welcome. It's been a large group of people that have been attending this FDA session going on, and it's just been incredible over the past couple of days. So I hope you've been enjoying it as much as I have. Over the past couple of days, we've been really talking about the retail flexible funding model in a number of different ways there. I think on the first day you heard Mary Beth Neeson talking about it. She was talking about the actual the program itself with all the base grants and the add-ons that are on it. FDA has set aside over the next 3 years $40 million to work on this project there. So there is a lot of input and emphasis from FDA on it. And we're really excited for the fact that they're really looking so hard at this area in retail food. And so thank you for that. Today, before the session, we saw the Comprehensive Strategic Improvement Plan. Thank you, Catherine Del Mundo and Becky Steiner for that. Really, it was really good to see how you walk through the process of developing one of the CSIPs there. And then after that, we saw Carolyn White and David Eggleskerchen talking about the work project implementation plan there. And that is also a key element to what you'll be working on with the grant process itself there. Today, we're actually going to talk about the grant submission process there. Next slide, Mike, please. The key people in this presentation, well, first, Dr. Chelsea Gridley-Smith from NEHA is going to be on this today, as will I, and we'll both be in the background after I get through talking on this first part here, mostly to answer questions as they come up in the different areas there and how we can help you out with this process there. But the two key presenters today are Art Johnstone and Mike Turner there. And they're going to be walking you through the grant process as far as the portal and how you actually apply for the different grants there. So thank you, Art and Mike, for doing that. Next slide. Some key important dates for you to keep in mind there. The grant portal did open. It opened on September 9th. I believe, Art, we had 130 so far jurisdictions that have registered for it. So there's a lot of folks that are already started the process on there. Thank you. There's plenty of time, although there's not an indefinite amount of time for you to continue to work on this, but they are due and it closes November 15th at 7:59 p.m. as far as all grant applications there. FDA really did a good thing on this by understanding where everybody is with all of the things that are going on in their jurisdictions, whether it's COVID or COVID or emergencies that are going on from disasters that are helping there. And they really extended this to the full 60-day periods to make sure that everybody who wanted to participate in it could participate in it. So November 15th is the close date on that. That pushes out a bit the actual start of the application date there. So it's projected to be the first part of February in 2022, and then we'll end December 31st in 2022 on that as well. So those are just some key dates for you to look at. I think with that, I'm just going to turn it over to Mike and Art to kind of walk you through the process itself there.
Yeah, thank you. For those of you who have been on the NEHA Retail Grants website, you'll know this, but we've posted 7 actions that are really important if you want to apply for grants through this program. As Rance said, lots of money in this. We're planning on giving away about $6 million for 2022. And as he said, nearly 130 jurisdictions have already registered. We've already had about 50 grant applications begun in draft. And we even had, so far, 2 eager beavers have already completed and submitted their grant applications. So you still have plenty of time, but some people are chomping at the bit and really moving through. But of the 7 actions, I'll just briefly talk about, summarize them. The most important thing is if you're not enrolled in the retail program standards, you can enroll. There's a link on the website. It's called Action 1 on the NEHA website, and that will get you to all the FDA places where you get the information. You find out who you send your enrollment to, and you can get that done really in 1 or 2 or 3 days. So that's an easy process. I know hundreds of you are already enrolled. And then actions 2, 3, 4, you can click through those when you have more time, but you're going to just determine your eligibility track. you're going to decide whether or not you can right now complete your own comprehensive strategic improvement plan, or whether you want to apply for grant funding to get help with that. And then you're going to decide, if you want to apply for a very basic grant through track 1 or some of the higher level grants through tracks 2 or tracks 3. So that's the second, third, and fourth things you want to do. Fifth thing, you need to register. And again, a lot of people have already done it, but that's a very quick process. Literally takes about 5 minutes to register. And this is a brand new grant program. So it's a brand new portal. If you're going to apply for grants through this program, you need to register with this through the NEHA site. And then action 6 and 7 is the real meat. You're going to complete and submit a base grant. Everyone needs to do at least one base grant. And as you probably already know, there's 2 different types. And then there are 4 add-ons, and they all have to be complete and submitted. Jurisdictions can apply for up to 5 grants, 1 base grant, and most will be eligible for 4 add-ons. And all of those have to be complete and submitted by November 15. And in just a minute, Mike Turner is going to show you a little bit exactly how that's done. So Mike, next slide, please. So, and I think, Mike, you're going to take it away and talk through these. Is that correct?
Yeah, I'll take it from here, Art. Thanks for the lead in, and Rance for the introductions as well. For the 130 of you who have already registered for the portal, you can skip the next few steps that I'll talk about. For everyone else who is interested in registering for the grant program and applying for these tremendous opportunities, follow these next steps. I'll mention this. There is a plethora of information on the retail grants homepage. Again, that is neha.org/retail grants. And in just a moment, I'll show you the phone number and email address where you'll get live support from our team. So never, ever feel frustrated at all. You have a full resource of staff here ready to assist you in any way possible. But really, first few steps, what do? You register for the grant portal by going, again, to that neha.org/retail grants website. You're going to see a large button at the top of that screen where it reads Access the Grant Portal. It'll take you to the grant portal landing page. Once you have a username and password, we'll talk about that in a moment. But for all of you new enrollees who do not yet have an account with the NEHA Retail Grants system, you're going to scroll all the way to the bottom, and there is a Create an Account Now button. You'll go ahead and click on that. That'll take you to a 3-question eligibility quiz. The surprise answers are yes to all. In order to advance and move forward, you need to answer yes. But what are you answering yes to? Yes, you have to be a tribe, territory, state agency, or local food protection agency. You have to be enrolled in FDA's Voluntary National Retail Program Standards. And we also ask that you coordinate with other staff members within your jurisdictional agency, just to make sure nobody else is in fact already applying or has created an account for this grant program. So if you answer yes to all of those, it'll take you to a registration page. This is where you're going to get into the specifics of your information: name, email address, phone number. How are we going to reach you? It's also going to get into your agency, address, email, all of that stuff. There's also we'll be asking for an authorized official. In some cases, this may be yourself. In other cases, this is the person responsible for signing off on any grants that may reside within your agency. So that simple 1-page registration, you'll submit that. And then, at that point, we say 2 days. Just sort of be monitoring your email. We say 2 days. Oftentimes we'll get to this in as short as 2 hours, and in some cases, 20 minutes. We're doing some checks with the FDA, making sure that you are in fact enrolled in the program standards, setting up that account on the back end. And then within that period, within those 2 days, you'll receive an email from us with your username and a link to create your password. Again, here's our email address and phone number. Write this down. It is toll-free 1-833-575-2404 and retailgrants@neha.org. Again, our team here dedicated to you to get you through that process as quickly and easily and painlessly as possible. All right, so once you have that username and password, you're going to head straight back to that neha.org/retailgrants website. You'll click on Access the Grant Portal, that button at the very top, and you'll use that username and password to log into the system. If at any point you forget your password, we know there's quite a lot to juggle. Have no fear, you can click on Reset or Create Password just on that same landing page. If you have any troubles with that whatsoever, again, feel free to call or email us. So in just a moment, we're gonna get into a live demonstration, but Art, why don't you talk through what we're gonna cover here?
Yeah, and I did just see a good question. Should only one person from your agency register? That is the best practice. One person should register, and you can reach out to us if you have more questions on that. But we wanted to actually just show you what the portal looks like, what it feels like. We think that's the best way to really get you familiar with how to navigate. But no fear, you don't have to memorize this. Everything that we're going to cover here is in the grant guidance that is posted on that NEHA Retail Grants website, including screenshots and pictures. So it should be pretty simple, but we're going to walk through how to navigate in the grant portal. We're going to talk about how to edit, save, and close an application. If you want to come back to it later, we're going to talk about getting back into the application and how to avoid creating duplicates and what to do if you do create a duplicate. And then we want to really hit hard the budget worksheet section, which is pretty powerful, but a little bit complicated. So we'll show you that. And then we want to show you how to both submit your applications and also how to confirm that they've actually been submitted. You will get an automated email when you submit, but it's always nice to be able to log into the program and see that for yourself. So we'll cover all of that. So with that, Mike, if you want to pull up the grant portal, we will show them what it looks like. So you're going to log in with your username and password, as Mike said. And if you forget and you need to reset the password, all you need to remember is your email address that you registered with. If you put in your email address, it'll give you both your username and let you reset the password. But when you get into the grant portal, we call this the grantee portal. You all are the potential grantees. And you're going to come up to a landing page and if you look on the left side, that's your navigation screen, and you're going to see that it defaults to eligibility criteria. So what you're going to do is, Mike, if you scroll down on that eligibility criteria, the first thing you want to do with this program is determine what track you're eligible for. And the track you're eligible for determines how many and which grants you can apply for. There's three tracks, 6 different grants. But this will walk you through the eligibility criteria. And this is really important. I know a lot of people, there's a lot of moving parts, a lot of possibilities in the RFFM grant program. The most important thing to remember is if you narrow it down for yourself, if you figure out what track you're supposed to be in, we have set up a process that will walk you from there. So that's really, you've got to look at the documents, you got to look at the website, figure out what you're eligible for, figure out what you want to apply for. But after that, it gets really simple. And again, I want to talk a little bit about that left menu. There's a lot there, but the most important place for you is this top part, which is labeled, Mike, if you scroll down just a little bit, that is labeled the, I don't even remember. The information section. That's where you can get the eligibility criteria and where you can get those apply now areas where you actually apply. The other important section is right below it, applications. And we'll show you a little bit that in real life in a minute. But under the application section, the most important things to look at are the links that say draft applications and the link that says submitted applications. As you create draft applications, they're going to show up under that left link under draft applications. When you submit, they'll move to submit. And again, we're going to show you a little bit more on that. So if you're on the landing page of the grantee portal and you know what track it is, the next thing is to hit one of those apply now buttons. Let's say you are a jurisdiction that has enrolled, you've completed, and you've got a current self-assessment of all 9 standards. You have taken the time to complete a comprehensive strategic improvement plan. That means you're eligible for track 2. So Mike, if you'll click on track 2 there. And this is going to show you all the grants you're eligible for and what are the buckets you can apply for, the funding buckets you can apply for. In track 2, you can apply for a development-based grant, which is up at the top, and you can apply for all 4 of the optional add-ons. You will apply for each of these individually. So the first thing you're going to want to do is from the top is you're going to want to do your base grant. Since that's required, we'd love everybody to do that first. So Mike's going to click on the development-based grant. And as soon as this loads, and during certain times of day, during the afternoon when everybody's on it, because it's a web-based program, it might be a little bit slower, but it's never more than about 15 or 20 seconds. But right now, Mike has now opened a grant application. This is a development-based grant application. And all of the applications start out looking very similar. You've got some key information at the top to tell you where you are. And then as you scroll down, you're going to see your organization name. You're going to see your organization location, the information you put in during registration. And then you're just going to confirm your point of contact, which is going to be preloaded from when you registered. And you just do that twice. And then you're going to go down and look at your authorizing official information, assure it's correct. This year, since you just registered, for most of you, it's going to be correct. And you're going to say yes. Maybe next year things are going to change. You can say no and put in new information. But for this year, most of you are going to say yes there. And then for all 6 of the grant types, you're going to come up to a colored section here that has a couple eligibility questions. And even though you've already gone through the eligibility in your head, we've just given you some key questions to make sure you're in the right place. So if you're in track 2, you're going to say, yes, I've got a current self-assessment. Meaning that it's been completed September 2016 or later. So you're going to say yes. You're going to enter the date of that self-assessment. You're going to say yes, you've completed your comprehensive strategic improvement plan. Again, a requirement for tracks 2 and 3. So you're going to say yes there. And then you're going to go down below and you're going to follow the instructions, which says save and continue. And really, there's nothing below this right now. All you can do right now is save and continue. And Mike, if you scroll down just a little further, they can see the save and continue button. It's kind of hidden on my screen at least. But that's going to load and that's going to open up and you're going to see a new message. This one says, congratulations, based on the answers to the eligibility questions, you can apply for track 2. Again, every grant starts out this way. And now you begin filling in the application. And the most important thing here is read every box carefully. And Mike, scroll down to that project lead box so they can see that really carefully. You'll notice that project lead box is telling you what to put in there, but it's also telling you what not to put in there. And the reason for that is you've already probably, by the time you're applying, you've created your project implementation plan. Hopefully you've done it in a Word document or something like that. You can just cut and paste the specific information from there into the boxes here, and we're going to be recreating your PIP on the back end, which you can use later to manage your grant and also can be used by the NEHA staff to help you with reporting and all those kinds of things. So again, you're going to be walked through the process. You're going to fill in all these boxes. Scroll down a little bit more, Mike. The simpler grants are going to be very straightforward. There's going to be a few boxes to fill in. The more complex grants are going to have conditional logic where you might select a choice that then has new fields appear. But for these early ones, you're going to have a project date, a start date, and an end date. 4 of the grant types, as you probably already know, are 1-year grants. 2 of them are 3-year grants. So that'll help you know what to do there. It's going to ask you a question about how many standards you've met in the last 5 years. You answer that. And then let's say that that's all you're going to do today. Let's say you've run out of time. What we want you to always remember is because this is web-based, if there's a hiccup in the internet, if you accidentally close out, you're going to lose any work that you've entered. So just go down to that save and continue button. Do that often. Every few minutes, every time you fill in a big text box, just hit save and continue. And that's going to allow you to make sure you don't lose any data. But when you're ready, when you're finished and you want to leave and come back later, you're going to hit the button that says Save and Close. And when you hit the Save and Close button, what it's going to do is it's going to take you right back to your grantee portal. And a couple of things you'll notice, you can still see your grant application, but it's no longer editable. You've got to, it's not in edit mode anymore. So right now it's just a record of what you've already done, and we'll tell you how to get it back to editable mode in a minute. But the other important thing to notice is over by draft applications, you now see a little orange 1. And if Mike clicks on the draft applications link, that's going to open up all your draft applications. So right now, once that opens, you're going to be able to go up and hit one update available. You'll click that. And once that refreshes, it's going to show you, and I'll pause there for our internet. It's going to show you that you've got one application in draft. And so if you had actually started, if you started your base grant, but you also started a couple optional add-ons, you would actually see 3 of drafts here. But however many drafts you have, right now we have 1 in this demo. You're going to see your draft applications. Mike is now going to click on that. And that's going to open up that draft again in a non-editable mode. And it's going to pop up on the right again. And we do see your questions coming in. I know that some of them are going to get answered in chat, but we're also going to have time at the end to do some Q&A for some of the real critical questions. What you're going to do is you're going to go up to the top of this application, and there's a little edit button. Once you hit edit up there, it's going to open this application and you can begin editing again. And now it's going to behave just like it did before. And you're going to be able to save and continue, fill out information, save and continue, et cetera. And then again, if you want to stop again, you save and close, you go back to the grantee portal. The most important thing is just don't recreate a new base grant every time you start. You're going to be frustrated. And you will not, if you create 2 draft base grants, you will not be able to delete one of them. We can, but you can't, and that's intentional. That's a safety feature, but just reach out to us through the email or the phone number and we'll delete the one that you want deleted. But you're going to get back into this grant application and continue to fill it out. And now I do want to show you the budget worksheet section, which is really important for every grant. Every grant, as was already mentioned earlier today by the FDA staff members, every grant has to have a detailed budget worksheet. So you're going to go down, you're going to be filling out fields as you go. You're going to hit save and continue a lot. Every grant is going to have a budget worksheet and justification section. It's going to tell you how much you can ask for. Each of these instruction sections are specific for the grant you're in. So make sure that you read them and read them for each grant that you're in. But get your head around that, read those, but then scroll down just a little bit further. And we've got for you to help you a really important infographic, because there is a little bit of technical wonkiness to how this budget worksheet works. So Mike, if you can scroll down, you're a little high for us, so I can't quite see the infographic. This little infographic will walk you through how to do the important things with your budget worksheet. It will show you, if you look up in the upper right, how to create a new budget worksheet. It'll show you how to edit an existing one. It'll show you how to delete a budget worksheet. If you make too many mistakes and you really just want to start over, you can actually delete your budget worksheet. You can't delete the whole application, but you can delete your budget worksheet. And then it also, on the left side here, it has, I call the link for a budget worksheet that's already been created, the link that begs to be linked, that begs to be clicked, but should not be clicked. And it's not a disaster if you click on this link, but once you've created a budget worksheet, if you click on the link, it will take you out of your grant application and you'll have to go back to the grantee portal and get back in. It can be frustrated. So just remember, stay to the right side of the budget worksheet section and you will be good to go. And Mike's going to go down here and he's going to show you how you would create a budget worksheet. So now that we've looked at the infographic, we've read the instruction, Mike, and just scroll down a little bit lower, Mike, so you can see that whole budget worksheet section. He's going to click on the blue plus sign, which is how you create a new budget worksheet. And he's going to, once he gets in there, the first thing he's going to do is he's going to name the budget worksheet. And again, you can look at the grant guidance for some example names, but you can name it whatever you want. But if you're in a track 2 budget, you might want to call it track 2 budget. And maybe this is a budget just for your continuous improvement outcomes. So actually, Mike, write track 2, track 2, if you don't mind, continuous improvement. And I'll tell you why I want to be real specific here. Track 2, example name's fine, Mike. He's going to put a start date for your budget worksheet, and he's going to put an end date. And this might seem redundant. You've already put a project start date and a project end date in, but remember, some of these are 3-year grants. Some of them you might want to add more than one budget worksheet. So we allow you, if you have just one budget worksheet and it's a simple grant, just put it in the project start date, the project end date, you'll be good to go. If you want to add more granularity, you can, but you'll do that at the top. You'll fill in some costs, and Mike's just going to fill in a couple budget lines here. You might want to put in, maybe you need 2,000 for personnel costs. And sorry for the little bit of lag here. And then you've got some other pre-populated section, but we've also got some wildcard sections. If you have something specific for your jurisdiction, you can actually define your own category and put that in. We've tried to think of everything, but if we forgot something, you've got 4 or 5 different self-definable categories. And so you'll fill all that in. And then at the end, once you've filled in all the numbers, you will go down to the bottom of this budget worksheet. And for each budget worksheet, you will find a budget justification section. And so you're going to want to fill out, and you've got 2,500 characters to tell us exactly what are your assumptions in building that budget, how you're going to spend that money, who the personnel are, just a little bit, because you've told us a lot up above, but just giving us some specifics that help us really understand your budget. And then you're going to do 2 really important things here. You're going to save your budget worksheet. So Mike, go ahead and do that. But you're also, after you save the budget worksheet, you're also going to do a save and continue. And I'll tell you why that is. If you just filled in a bunch of text before you did the budget worksheet and forgot to hit save and continue, that text is not saved yet. So after you save the budget worksheet, try to remember to save and continue. Again, not a disaster. You might lose a little bit of information, but again, the mantra of save and continue often. Now you have a budget worksheet added. Now you have the link to that budget worksheet that you probably don't want to click, but you can edit it and reopen it over on the right, and you can delete it if you want. And it gives you a summary. He just put $4,000 worth of costs in. And then when you're done with your grant, you're going to go up. If you've got one budget worksheet, Mike would just put $4,000 in. If he added a second one, he would, there would be a sum there total, and he would put the sum total for the whole grant application down below. I'll talk about right now, just briefly, why you might want more than one budget worksheet. I think for a track 1 budget, for a track 1 application, really simple, you're probably going to have one budget worksheet. But for track 2, where you have the option of both doing a continuous improvement outcome and you have an optional public health metric, you may want to do one budget worksheet, but you might want to do 2 that allows you to have a little more granularity. So that's where you would go through the same process. Mike, hit that blue plus sign. You would go in and you would define a second budget worksheet, and I'll just have him do that really quickly if it works. Go ahead there, Mike. And he's just going to put track 2 PHM for public health metric. He's going to throw in a start date and an end date for 2022. Again, this is a 1-year grant. And again, these could be different. Maybe you're going to do the continuous improvement the first half of the year, maybe the public health metric second, but they can overlap. They can be the same dates. That's fine. But let's say for this one, all you need is some personnel costs. So Mike's going to put $5,000. Actually, he's going to put $1,000 for equipment, and he's going to put $4,000. Well, $2,000 for contracts and $200 for, that's perfect. Just go ahead and save that, Mike. He's also going to remember to go down and put his budget justification in as well for this one. But he's going to hit save. And now he's got 2 budget worksheets showing. He can edit them if he wants. He can delete one and re-add one. But when he submits this, he's going to want to make sure his requested amounts matches the total of those 2 budget worksheets. So go ahead and put that to 7,200. And then, that's kind of the nuts and bolts of every single grant. Some of them are more complex than others and have more fields, but the process is the same. When you're done, again, you're going to be hitting save and continue all the way through. When you know you're done with your application, you're going to then hit save and close, just like you always do when you're leaving the grant. And when Mike hits save and close, the budget you just finished is going to be in front of you in non-edit mode. In a best practice, you should probably carefully review that. Make sure everything is just the way you like it. So you're going to scroll down all the way through that grant application. You're going to make sure everything is just the way you like it. And when you think you're ready, you're going to go ahead and hit the submit button, which shows up when you're in non-editable mode at the bottom of your application. So Mike is going to go ahead and hit submit, and it's not going to work in this case because, oh, I'm sorry, you're going to get a note. You're going to be able to add a note every time you submit. You can add one if you want. You don't have to, but he's going to say, okay, he's not going to add a note. And when he does that, he's going to get an error message. And the reason for that is he did not fill in all the fields because we were just kind of doing a little show and tell here. And when you do this in real life, it's going to jump you up to the top and it's going to say unable to promote. And it's going to walk you through all the errors, which in most cases are going to be fields that you forgot to fill out. So it'll walk you through what you need to fill out, and you'll go through there, fill that all out, and you'll hit submit. And eventually, and Mike's going to go ahead and save and close again. And we're going to get back to the grantee portal, and I'll show you a couple things more from the grantee portal. Now that Mike has worked on the draft application, and again, it can be, it can be edited, it can be opened back up until it's submitted. It's in draft right now because, again, we didn't submit, it's not done. But if he was done and he submitted it, it will leave the draft applications area. You would see a little orange 1 by submitted applications. You'd be able to click on the link and update that, and you would see that you now have a submitted application. Once an application is submitted, you cannot unsubmit it, but we can. So if you submitted something, said, wait a minute, I want to make a change, as long as it's before November 15 and you're going to be able to do your changes and resubmit it, reach out to the NEHA-FDA RFFM team, and we will put it back in draft mode for you. It'll move back to the draft box, and you'll be good to go. But just remember, all your drafts are under draft. All your submitted applications are under submitted applications. By the time you get to November 15, if everything has gone well for you, there should be nothing left in drafts and everything should be under the submitted section. So that's just kind of a little bit about what you're going to see in the grant portal. Mike, anything you can think of that I've kind of forgotten that we should highlight while we're in the grant portal? I think we're just about done here with this little show and tell.
Yeah, I think you covered it well, Art. Again, our team here to support you. If you ever feel that you're having some challenges with the technology, don't hesitate to email and phone us.
Yeah, and the last thing I'll say is just a reminder, everything we covered is in the grant program guidance. You can get that from the NEHA Retail Grants website. So pull that up and again, reach out to us as often as you need. But with that, Mike's just got a couple more slides, and then we have really, as long as you all want to stay, we're prepared to stay here till 3:50 and answer questions. We've left a good amount of time intentionally to answer some of these questions that you've been thrown in chat, particularly those burning questions. So Mike, why don't you get us through the last couple slides, and then we'll open up the Q&A.
Yeah, sounds good. Thanks, Art, and thanks for walking us through that. A couple of reminders. One of the most important things is to use a Chromium-based browser. It probably doesn't mean much to many of you, but if you have access to Google Chrome, if you can download Edge, if you can download Brave, any of those run on the Chromium platform. That is one of the requirements for using the grants management system. If you're using Microsoft Internet Explorer from years ago, it's no longer supported. There are some other browsers that may not render the application and all of the features that are built in as you need. So work with your IT departments as you need, but we strongly recommend using Google Chrome or one of the other Chromium-based browsers for your work. You may notice some other little quirks. Sometimes the save and continue and the save and close buttons will reverse. Don't worry. I think the big thing is to just make sure you're saving your work and saving it often, which is sort of our message. If Art wasn't clear, I absolutely want to make sure save your work, save it often, use the save and continue, use the save and close. You can start an application today. You can pick it up again in 3 weeks as long as it's still in draft form. Just as a reminder, and Rance went through these earlier, those important dates, the application portal is open right now through November 15th. It will be turned off at 7:59 p.m. on the East Coast for all of the applications. And then those first year grants, the project period ends on December 31st, and we're looking at February in the new calendar year for those new awards to begin. If you need that information, again, here's our phone number and email address, but in the coming years, get really used to typing in neha.org/retail grants. And now we stand by with whatever questions we need to address. And thanks as we've seen the chat coming through, continue to pop your questions in there. We'll try to get through as many of them as we can here in the coming minutes we have remaining.
All right, and Mike, thank you so much for that. There are a lot of questions, so there's definitely some things that we're going to need to be answering. Some questions, I think it's going to be the RFS that's going to need to answer those questions there, because they come more under the purview of the retail program standards than of the actual grant application itself there. So, but we'll get to the ones we can. We talked about the base funding, and then we talked about the optional add-ons on there. But one of the key differences this year from past years is that the mentorship program is not a separate program where you would go through to NEHA. For those of you who've been involved either as a mentor or a mentee on there. So I think that's kind of where maybe Chelsea, if you could help out with that, with what is going to be the same, what is going to be different in this actual grant application, if you wish to be participate in the mentorship program there.
Yes, thanks so much for the invitation to share that, Rance. So for those folks who I haven't had a chance to meet yet or work with, my name is Chelsea Gridley Smith. I'm the Director of Environmental Health at NEHA. And like Rance alluded to, NEHA is really excited to be continuing our 10 years of mentorship provision through NEHA's retail flexible funding model. And what's going to change? Really only the time frame. We used to operate through sort of an October, November through the following August. And now we are going to be working on the February through, we're anticipating our closeout end of year meeting to be conducted in early November, late October of 2022. So the timing of it is going to change, but in essence, everything else is going to remain the same. We certainly hope that we have additional folks applying for mentorship. We really will continue to try to share the benefits of mentorship to both the mentees and mentors in not only achieving conformance to new standards, but maintaining that level of conformance throughout cycles of self-assessments and verification audits. We have found over the years that programs who participate in the mentorship program excel and achieve new standards and have those standards verified in a timely fashion. And we're now doing new research, which is indicating that the folks who are enrolled in mentorship and participate in mentorship are doing this at a little bit of a quicker pace than folks who are not participating in mentorship. So I really urge folks who have not participated in mentorship before as either a mentor or a mentee to consider it. Feel free to reach out to us at NACHO. You can also get to us through your contacts here at NEHA. We've got a direct line of communication, and our team at NACHO is ready to answer any questions. The nice part is it's all going to be funded through NEHA. You're going to apply through NEHA. You're going to work through the paperwork's going to be through NEHA. Reimbursement's going to be through NEHA, all in the same portal, same contract and everything. So we're really excited that hopefully as we move through this first year, all the kinks are ironed out and it really becomes a seamless process for folks all around.
Cool.
And
Thank you.
Rance, I see I can do a lightning round and hit a bunch of these questions quickly. You want me to do that? I've checked the chat and can do that really quickly. Okay, I see a thumbs up. There was a question about the PIP. Is this how we submit the PIP? I think the answer is kind of yes. The PIP does not need to be submitted to FDA nor to NEHA, but essentially, if you cut and paste those fields, you will be submitting that information in the grant application. So I hope that makes sense. Someone asked, I can't edit the people cards in Flux. That is correct. If you need any edits to the people card, reach out to us. We can do that for you. That's really a safety feature for you in case there are people that, more than one that have access. How will I get a grant notification? Those will come through email, and you will be able to download an official award letter through the grantee portal. And again, those will go to the POC who was registered with your agency, and those will come probably in late January or sometime in January, most likely. What reports do I need? Do I need the SF 425? Everything to do with this program will happen through the portal. There are none of those federal forms are required. You'll still submit your retail program standards forms for verification audits, for self-assessments through FDA like you always do. But in terms of grant reporting, grant applications, grant closeout, all of that are simple electronic-based forms that are done through this portal. Is there a simple way to share applications with others in my agency? There is a print button when you have that application open. So at any time, if you're halfway done, if you're fully done, from within the portal, you can print that application out. A couple of you have asked, are there any samples of applications? Are there samples of budget justifications? The answer is no, not yet, but we are working feverishly. Hopefully by next week, we will have a kind of a generic example of each of these grant applications on the NEHA website. Stay tuned for that. Somebody asked a good question. If we realistically don't think we have time to do much in the next few years, and we put that on our CSIP, on our Comprehensive Strategic Improvement Plan, will we be dinged and not get funding? The answer is FDA knows there's a lot of pressures, particularly with COVID. This program is set up to allow you to move at your own pace. You can be completely honest with that Comprehensive Strategic Improvement Plan. You can choose not to apply this year and apply next year. You could apply this year, but not next year. I mean, you've got full flexibility to use this program as needed. The only caveat is, well, let me say something that we haven't said that's really important. There are 2 3-year grants that are offered. One is the Maintenance and Advancement Base Grant, and the other is the Capacity Building Grants. Those are 3-year grants. They are not 1, 2, or 3-year grants. They are both 3 and only 3-year grants. This year is your only chance to apply for those for the next 3 years. So if you want to get into some of those bigger grants, now is the time. But for the 4 1-year grants, they're going to be, as long as federal funding continues, they'll be available next year. They'll be available the year after. And conceivably, if this program continues, probably 4 years from now, you can get back into those longer grants. And that leads me to the caveat I wanted to mention. You can only stay in the development-based grant for 5 years. So everybody gets a clean slate. Doesn't matter what you've applied for in the past. Everybody can stay for 5 years, but eventually, if you want to continue to get funding, you're going to have to jump into those 3-year grants. So I hope that wasn't too fast or too much. I'll kick it over to Rance now, but I'll say one more thing. If you don't get your question answered today, please put your detailed question into the question and answer engine that's on the NEHA website. If we can't answer it, we will send it to FDA and they'll get you the answer. But anything you have a question about, you can put into our portal or you can call us and we will do our best to answer it. But Rance, what else do we have to answer or to talk about?
Well, Art, just on the last piece that you were putting up there, I think we can probably say that, and it's in the grant guidance that we have listed there as well. We will not be rating your grant application on your CSIP. It would actually be on what you apply for in the actual grant itself there. So if you're not applying for all of the standards on there because you don't have the time or don't want to have funding to work on all the standards there, apply for what you will work on. And which ones you're planning on meeting, which ones you're planning on conforming, which ones you're planning on doing maintenance. There is no requirement that you have to have something in this grant application for all 9 standards or the 8 standards plus the public health metric on there. So just it really is. It's realistically when you're doing the grant application, what you can do, and that's the area that the grant will be reviewed on. Let me see if some questions on there, because I think you got a lot of them on there already.
Rance, I have a couple more that I can just hit real quick. Do you have to register every year? No. As long as this program's open, you register once. You apply for grants. If they're 1-year grants, you will apply in subsequent years. If you've got a 3-year development base, but a 1-year mentorship grant, you will apply just once for the 3-year grant, but then you will reapply for the 1-year mentorship if you want to do that again next year. So that's kind of how that works. And there were several questions about dollars. How do I get my money? That does come from, there's nothing to do with the federal sites and the payment program. It's going to be a simple process. It's going to go through NEHA. There is the ability to get money up front if you need it. You can also get money on a reimbursement basis if that's easier. There was also a question about, does the money just go into the state coffers? That's really up to you and your state. NEHA is going to send that money to wherever you tell us to send it. We're not going to send it to your own bank account. It's got to go to an agency account. But what happens to it within the agency is really going to be according to your agency policy. So Rance, I'll kick it back to you.
All right, I think we're kind of down there at the end there. So I'm going to kick it over to either Crystal or Tracinda.
Okay, thanks guys. That was very informative. As a reminder, the next workshop we've got to leave this one and go join the next one, and we'll give you guys a little bit 10 minutes before the next one starts. And the recording for this will be up in the agenda card probably within the next couple hours. So if anybody wants to share it or view it again, you're able to do that. Thank you, panelists, and have a good day, everybody.
Thanks, everybody.
Thanks all.
superintendent.
Hey, is anyone there?